ஹாய் ஃப்ரெண்ட்ஸ், வெல்கம் டு நர்சிங் ஜெல்ஃபிஷ். ஆல்ரெடி நம்ம ப்ரீவியஸ் கொஸ்டின் பேப்பர் பார்த்துட்ருக்கோம். பட் இன்றைக்கி நம்ம மாடல் கொஸ்டின் பேப்பர் என்ன மாதிரி கொஸ்டின்ஸ் கேட்கலாம் அப்படின்னு ரிலேட்டட் டு பீடியாட்ரிக் நர்சிங் பார்க்க போகிறோம். ஸோ த ஃபர்ஸ்ட் கொஸ்டின், the nurse is aware that the most common assessment finding in a child with ulcerative colitis is option A, abdominal distension, option B, anal fissure, option C, profuse diarrhea, option D, intense abdominal cramps. What is the correct answer? Actually question என்ன அப்படின்னு பார்த்தீங்கன்னா, the baby is having ulcerative colitis. Already the colon was inflammations. So what could be the main symptom is going to be developed. So what is the correct answer here? Usually what it is getting? Yeah, what is that? Option C, profuse diarrhea will be the correct answer. Move on to the next question. When administering an IM injection to an infant, the nurse in charge should use which site it is? Actually, we are going to give a IM injection for the child. So option A, dorsogluteal, option B, deltoid, option C, ventrogluteal, option D, vastus lateralis. So எந்த site வந்து it is suitable for the IM injection for the baby infant it is. So which site is comfortable it is? Yeah, which one it is? Vastus lateralis. For toddler, which site is comfortable? That is ventrogluteal and dorsogluteal. So that site is suitable for the toddler child. But most of the IM injection for the infant அப்படின்னு சொல்லும்போது vastus lateralis இல்லை. That is more muscle and also safer site because arteries and nerves are it is deviated. That's why we are selecting the site. Okay, got it now? Okay, move on to the next question. When developing a plan of care for a male adolescent, the nurse considered the child psychosocial needs during adolescent psychosocial development. Focus on option A, achieving intimacy, option B, becoming industries, option C, establishing on identity, option D, developing a initiativities. So what is the correct answer here? Usually when the adolescent people, what they will think, they want to show a identity. So what is the name like that it is? So அதாவது adolescent வந்து அவங்களுடைய நேமை தான் they have to show off. So that is why establishing a identity will be the correct answer. Move on to the next question. According to Maslow, the highest level on the hierarchy of needs that people strive to achieve is option A, love and belonging, option B, safety needs, option C, esteem needs, option D, self-actualization. So what is according to the Maslow hierarchy, which one is the higher priority of the needs it is? What is that it is? So that is called it as self-actualization. So that will be the highest priority needs for the human being. So got it now? Okay, next move on to the another question. What is characterized by chronic progressive chorea? There is involuntary, irregular, twitching and jerking movements with mental deterioration leading to dementia it is. So which condition is coming? Okay, என்னென்ன ப்ராப்ளம் இருக்குது? ப்ராக்ரெசிவ் கோரியா வித் இன்வாலண்ட்ரி மூமெண்ட் இருக்குது, irregular twitching, jerking movements and mental deterioration. So these are the symptom is coming. Which condition it is? Option A, Huntington's chorea, option B, Alzheimer's disease, option C, Pick's disease, option D, Parkinson disease. So which condition these all the symptoms are coming? Usually what is a Huntington chorea? It is an inherited disorder result in death of brain cells. So that is why you will be getting the mood and mental disabilities. So that is why the correct answer is Huntington's choraitis. Suppose உங்கள் யாருக்காவது ரிஜிஸ்ட்ரேஷன் ரினிவல் BLS CNE ரிலேட்டட் எந்த என்கொயரியாக இருந்தாலும் நம்மளை காண்டாக்ட் பண்ணலாம். So which of the following condition is usually diagnosed with Wangstein Rice X-ray? Option A, cleft lip with following the is not a sign of severe dehydration in children. Option B, pyloric stenosis. Option C, anorectal formation. Option D, esophageal atresia. Actually question என்ன அப்படின்னு பார்த்தீங்கன்னா, Wangstein X-rayல எந்த டயக்னோசிஸ் வந்து we can't able to identify, அதுதான் கொஸ்டின். ஸோ அப்படிக்கு பார்க்கும்போது which is the correct answer அப்படின்னு பார்த்தீங்கன்னா, so that is anorectal malformation, cleft lip, pyloric stenosis, esophageal atresia, everything is going to be diagnosed with Wangstein Rice X-ray. So that is why anorectal malformation we can't able to identify this X-ray. So that is why option C will be the correct answer. Move on to the next question. Tightness of the prepuce foreskin of the penis is called? Option A, phimosis. Option B, prostatitis. Option C, archititis. Option D, phalangitis. It is easy to identify because all itis is going to be inflammation, but the question is tightness of the prepuce of the penis it is. So that is why option A, phimosis will be the correct answer. Move on to the next question. Inflammation of testis is known as option A, otitis. Option B, archititis. Option C, cystitis. Option D, ophritis. What could be the correct answer? It is an inflammation of the testis. So what is the term to describe that? Is testicle infection it is. So the correct answer is option B, architis. Move on to the another question. Circumcision performed to correct which condition it is? Option A, phimosis. Option B, epispadiasis. Option C, hypospadiasis. Option D, herniatis. So what could be the correct answer? Yeah, what is that? It is phimosis. So usually வந்து circumcision எந்த கண்டிஷனுக்கு பண்ண போகிறோம் அப்படின்னா covering of the layer, forcing coverage இருக்கு இல்லையா. So the foreskin we are going to remove with the surgery. So that is called it as circumcision. So that is correct answer is phimosis. Suppose உங்கள் யாருக்காவது எய்ம்ஸ், நார்செட், ESIC, ஜிப்மர், எம்ஆர்பி, ஆர்ஆர்பி கொஸ்டின் பேப்பர் யாருக்காவது நர்சிங் ரிலேட்டட் கொஸ்டின்ஸ் பேப்பர் வேணும்னா கண்டிப்பாக தாராளமாக நம்மளை வந்து காண்டாக்ட் பண்ணலாம். PDF ஃபார்ம் அவைலபிள். Even mock exam also available in the Nurse Genius app. Okay, next move on to the another question. Next question. Condition in which there are no spermatozoa in the semen is termed. So what is the name to called? Option A, azoospermia. Option B, aspermia. Option C, asthenospermia. Option D, teratospermia. What could be the correct answer? That means what is that? In that there is no spermatozoa in the semen. So எதுவுமே இல்லை அப்படின்னா so what is the term to describe it as? That is called it as azoospermia. So option A will be the correct answer. Move on to the another question. A total number of pair of chromosomes in each mature germ cell is option A, 46. Option B, 24. Option C, 23. Option D, 48. So what is the correct answer? So what is the number of chromosome it is there? Totally pair of chromosome they have as total number of chromosome எத்தனை அப்படின்னு பார்த்தீங்கன்னா 46. pair of chromosome அப்படின்னு சொல்லும்போது 23 chromosome. So that means what is the correct answer here? Option C will be the correct answer. You can read the questions properly and tell the answer. Next question. The normal duration of spermatogenesis. Option A, 100 days. Option B, 30 days. Option C, 74 days. Option D, 64 days. So what could be the correct answer? அதாவது ஜெர்மட்டோஜெனிசிஸ் sperm production வந்து எவ்வளோ நாளில் நடக்கும்? How many days it will take for the sperm production it is? So what could be the correct answer? It means option C, 74 days will be the correct answer. Move on to the next question. The toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will option A, need more calories. Option B, grow normally. Option C, tired easily. Option D, be more susceptible to viral infection it is. Actually the baby is having, the toddler is having cardiac anomaly it is. Okay, அந்த மாதிரி கண்டிஷனில் ventricular septal defect இருக்கும்போது so what could be the problem is going to be arising? So what type of the problem is baby is giving this? So what is the correct answer here? Daily we will see more questions according to the paper. It is different subject also. So now today we are looking for pediatric nursing paper. Okay, got it now? Okay, option 10-month-old child has been assessed for pain and has received a score of 2 on the neonatal infant pain scale, NIPS tool. What does they indicate about this pain level it is? So score level எவ்வளோ அப்படின்னு பார்த்தீங்கன்னா score is 2 it is. Option A, he is not in the moderate pain. Option B, he is not in pain. Option C, he is in mild pain. Option D, he is in severe pain it is. So what could be the correct answer here? யூஸ்வலாக வந்து தட் NIBS அதாவது நியோனேட்டல் இன்டென்சிட்டி ஆஃப் பெயின் ஸ்கேல் எவ்வளோ அப்படின்னு பார்த்தீங்கன்னா, ஸோ இஃப் இட் இஸ் 3 அப்படின்னா லெஸ் தென் 3 இட் இஸ் there is no pain indicating. ஸோ அப்படி பார்க்கும்போது more than 3னா தான் it will be causing the pain it is. Facial expression and respiratory test we are going to be monitored after 3 the score will be 3. So அப்படி இருக்கும்போது if it is score is 2 only, so that means what is the correct answer? He is not in pain, so option B will be the correct answer. So the pain score less than 3 na no pain, more than 7 na severe pain. I think you will understand the answer. Move on to the next question. The best home treatment for CREP in a 2-year-old is. So CREP அப்படின்னு சொல்கிறது one type of the throat infection. Do you got it now? Okay. Option A, cold mist humidifier or steam therapy. Option B, aspirin if there is no fever. Option C, antibiotics prescribed by his physician. Option D, over-the-counter cough syrup and decongestion. So what could be the correct answer for this question it is? So the correct answer is cool mist humidifier. Option A will be the correct answer. ஏன் அப்படின்னா the bathroom air and the car showering help to moisten the airway and thick the mucous membrane it is. So antibiotic we should not give, and also aspirin வந்து ரே சிம்ட்ரம்க்கு கொடுக்கவே கூடாது. So that is why option A will be the correct answer. Next, move on to the another question. What is the therapeutic serum lithium level? They will ask this question வந்து pediatric கேட்பாங்க, அதே நேரத்தில் psychiatric they will ask. So option A 0.2 to 0.6 milli equivalent per liter. Option B 0.6 to 1.2 milli equivalent per liter. Option C 2 to 3.5 milli equivalent per liter. Option D 3.5 to 5 milli equivalent per liter it is. So what is the correct answer here? So the correct answer is option B 0.6 to 1.2 milli equivalent per liter. Move on to the next question. During which week does the fetal heart begin pump in the own blood test? எப்போ வந்து fetal heart begins to pump? So option A 4th week, option B 3rd week, option C 5th week, option D 6th week it is. So what could be the correct answer? எப்போ வந்து baby it begins to start to pumping the blood test? So யூஸ்வலாக எப்போ நடக்கும் அப்படின்னா 22nd days it is during conceive ஆகி 22nd daysல. That means what is the correct answer here? Option B 3rd week will be the correct answer. ஸோ இந்த மாதிரி மோர் கொஸ்டின்ஸ் வந்து இனிமேல் வந்துக்கிட்டு இருக்கோம். அப் டு MRP எக்ஸாம் ப்ரிப்ரேஷன்ஸ் யாரெல்லாம் ப்ரிப்பேர் பண்ணுறீங்களோ ட்ரை டு ப்ரிப்பேர் ஃபார் இட். ஸோ நம்ம சேனலில் கண்டிப்பாக வந்து மானிட்டர் பண்ணிக்கிட்டே வாங்க. whenever notification is coming I will inform you. Okay, next question. When developing a plan of care for a hospitalized site, does Alicia knows that children in which age group is most likely to view illness as a punishment for missed dates it is? Option A school age, option B preschool age, option C infancy, option D adolescence. So in the age group la the baby will get a punishment as a missed dates. So illness, so when which age group it is? So what is the correct answer here? Preschool age it is. If you like this video, please like and subscribe channel. இந்த மாதிரி more questions paper இனிமேல் வந்துகிட்டு இருக்கு. நம்ம சேனலை மறக்காம ஃபாலோ பண்ணுங்க. இது ஜெல்ஃபிஷ் மீனா. Thank you for watching. All the best for your exam.